We're seeing some improvement.
Okay.
I mean, there is a lot more awareness. And even many years ago, 30, 40 years ago, I mean, we didn't even have any sunscreens whatsoever. Right. Everybody was out there, as I was too, right. With baby oil and iodine and the reflectors. That was the thing to do. Right. So we really didn't even know, and we didn't have sunscreens. But now it's so different. We have sunscreens. We are aware. But many people are still out there getting a lot of ultraviolet radiation when they really do know the risks.
Right, and you know, there has to be such a word of caution, and this isn't. People may choose to tan. There's a certain image that is associated with we're tan, we're healthy, right? People make it's inbred, I think, in our culture, in American culture.
Right, yeah. It is conditioning. And in the office, I tell people all the time, we have to sort of get back to that 100 years ago Victorian feeling where
Umbrellas.
the pale is the pale is the healthy. Right. But it'll take many years.
I'm afraid so. I'm afraid so, and particularly for younger adults who are still connected to that belief very deeply. Lucille, I know the Somerset County Cancer Coalition does a lot to try to raise that awareness and increase education. What sorts of activities do you do specific to skin cancer? I know you do so many related to all different types of issues.
This is a perfect segue to talk about promoting health education and how it really works, because what you just said about there is a little bit of a improvement from years ago and people being aware of what they need to do. Our overarching goal for the Cancer Coalition for all cancers is definitely early detection is the best prevention of cancer. And that is so applicable to skin cancer because there's so many different things that we can do to reduce our incidence. Some of the things that we've done in the past is to focus on caretakers and parents of children, because children aren't certainly going to be putting sunscreen on by themselves, although I shouldn't say that because they see things on TV and they start to. Right. But we've done a lot of activities. We had some really fun activities that we created and developed and took out into the community to teach parents about the importance of not only putting on sunscreen, but when to apply it and how to apply it. We have a quiz game on a board that the parents came up and they were playing with the kids at Patriot Stadium called Safe Sun Home Run. It was a huge hit. We had tons of fun.
No pun intended.
Yeah, no pun intended. But the surprising thing was that the parents really didn't know that they should apply sunscreen, for instance, on the kids before they go out in the sun. And it's not just when they're going to the beach, it's when they're going to school. That's right. So we had some really fun things that we gave out to the kids. Sunglasses. We have sunglasses that, you know, have some information on them. And some Frisbees, because these are activities that kids do outside. So other things that we've done is to take this to schools, to churches, to community events, to health fairs. Actually, anybody who wants us to come out and do education on sun safety and skin cancer and how to do your own skin examination, we'd be happy to come out to anybody's events.
Excellent. And we'll be sure to have your number posted on the program so viewers can choose to contact you directly.
Right. We'll be at the 4-H fair, because that's a huge way to reach out to people. We've done that every year in the past. And also, really important, one thing that we did do this last year, was to distribute to all the school nurses and every local municipal health department this DVD, which is called The Dark Side of the Sun. And it's a wonderful resource about sun safety. A young girl who was diagnosed with melanoma, who died at the age of 20, unfortunately. Her parents felt the need to create something to help people to understand the importance of sun safety. This is a great resource. All their local health departments have it, the school nurses, but you can also get it online. You can access that online. So
and we'll have that information as well, for sure.
And it shows you how to do a sunscreen examination yourself.
Great.
And then we also have a really cool tool that we take out to the community called the DermaScan. It's just, it's a little machine. We worked closely with the American Cancer Society when we decided to do this. We take it out into the community, and it doesn't diagnose people with skin cancer, obviously, but it's an awareness tool where people look into this little machine. It's non-invasive, and they can see if they have sun damage. And any skin damage from the sun or just from dry skin requires some sort of action or follow-up.
Or at least an evaluation.
So it allows us to tell people to start using lotion with the appropriate sunscreen.
Excellent.
So
Thank you.
that's just like a snapshot of some things.
And that's why you're always so busy, right?
Yeah.
And these are all
It's a good
free,
thing.
correct? These are all free programs.
Yep, everything's free.
Excellent,
for the
excellent.
community.
Dr.
Fabulous.
Fox, as Lucille was alluding to, in addition to the early detection and how critical that is, prevention obviously is the key message here. So for people who are watching this, of course they want to take part in screenings, and we're going to talk about reaching out to the types of physicians they should contact, but what can we do at home? Sort of on a routine basis, when we talk about looking at changes in our skin, well, how exactly should they be doing that?
Well, everybody should be doing self-exams, and pretty much we recommend once a month to check moles.
Okay.
Just the way doing a once-a-month breast check or a testicular check for a man, to once a month check one's skin. Good lighting, a mirror, and just almost memorize the moles that are there. Some people at home take pictures of their moles. They do, they do, and it's a way to track moles as well.
Yeah.
If you have a lot of moles, and just really become familiar with your skin and your moles on a monthly basis, so that if there are changes, then you will see them over the course of a few months.
Right, right. And it's so important that you mentioned to use a mirror, and I would even add using 2 mirrors so that you can clearly see your back in the mirror behind you. And
it's not easy.
It's not easy, and not everyone has someone who can make those judgments for you. So excellent. Now, Lucille, when you alluded to the DermaScan as one tool that you've used, right, for early detection, but there are some other activities you are involved with as well at the Cancer Coalition?
Well, we try to reach out to every community in Somerset County. So we work really closely with all the nonprofit organizations, reaching out especially to those people who have challenges with access to care, because not everyone can afford to go see a dermatologist, especially if something's found. So we work with the Women's Health and Counseling Center in Somerville, for instance. And we work closely with the local municipalities to try to conduct skin cancer screenings with a dermatologist.
So that's far more, doing a skin cancer screening with a dermatologist, are they typically a full body screening then, as opposed to the DermaScan where it's just face?
Right, the
Is that
DermaScan
correct?
is just a little machine, and it doesn't diagnose, it doesn't diagnose at all. It's just an awareness tool that you look in, and it can tell you if you have some sun damage or skin damage, dry skin on your face and your neck. Where a dermatologist would complete,
do the full
the
body
whole thing
screening.
with the gown on and in privacy. So, so that would be the difference in a skin cancer screening. Also, when someone's diagnosed with skin cancer or any kind of cancer in Somerset County, we have a wonderful resource called the Wellness Community. The Wellness Community is in Basking Ridge. It's actually called the Wellness Community of Central New Jersey, and they offer all different types of support, including support groups and counseling and classes and how to survive, and then they have wonderful resources for survivors on cancer.
It's a great organization.
We work very closely, of course, with Somerset Medical Center and the American Cancer Society to promote education and awareness, skin cancer screenings, so we all do that collaboratively.
Excellent. Now, Lucille, all of those entities that you've mentioned, and I'm sure many others, are a part of the coalition. Is that correct? Okay, so you have a real cross-section of organizations involved with the coalition.
Oh, there's over 50 organizations that are part of the Somerset County Cancer Coalition.
Excellent. And they all volunteer to be a part of this?
It's a volunteer organization. It's made up of leaders of local organizations, a lot of nonprofit organizations, but we also have volunteers, and most importantly, we have cancer survivors that sit on our Cancer Coalition, and they help us to go out and do education and conduct outreach activities.
Excellent. Now, how you mentioned, the cancer rates in the other counties, and I know that there are cancer coalitions in each county in New Jersey. But how does that funding work? Who actually supports these efforts? Because certainly there's some expenses.
Actually, New Jersey is a state leader in the nation. How we are coordinating our Office of Cancer Control and Prevention in the nation. So the State Department of Health funds through the Office of Cancer Control and Prevention to the Somerset County Health Department so that we can conduct outreach and education and have a comprehensive cancer program. And then every county in New Jersey, there's 21 counties, also have funding to focus on cancer in their own community. The really important thing
so
is
you're
that
replicated,
right, but it's unique because each county has their own blueprint based on statistics that are available to us of which cancers are most important to focus on in that particular county and community. So it goes from the state to the county to the community level.
Excellent.
For instance, we do a lot of education and outreach on breast cancer and prostate cancer in Somerset County. Not that we're not focusing on skin cancer, because that is rising.
Okay. That, you know, that's the perfect example to me, and I always have to give the plug for what public health does. I mean, it's the perfect example of assessing the need, you know, and finding out what is the most appropriate target. I mean, the